Well, joining us right now, we have gastroenterologist Dr. Wiley Trust, and we are about to talk about colon cancer. I know it's something that a lot of people don't like to talk about, especially getting colonoscopies, but definitely something that we need to keep on the forefront of our brains and take seriously, especially because you guys are starting to see younger and younger people impacted by this. Is that right?
Yeah, that's right, Kelsey. And you know, colon cancer is actually the number 2 cause of cancer-related mortality in the United States. So it's a very common cancer. It's the 3rd most common cancer in the United States by new cases, but it's also the 2nd most common cancer killer in the United States.
And you were telling me that typically this was something that people who are a little older, maybe 50s or 60s, would be concerned about, but that's not the case what you guys are seeing anymore, right?
Right, exactly. So it used to be something that we'd worry about in our 50s or 60s, and actually the screening for colon cancer used to not even start till 50, but now more and more societies, including the American Cancer Society, is recommending we start screening at age 45 because there is a higher incidence in younger people that we've been seeing over the last decade. While we're doing really well with getting rid of colon cancer in patients over the age of 50 with the screening colonoscopies and screening tests, in the people under the age of 50, it's actually a 2% per year rise. And you know, I've actually diagnosed people in their 30s with colon cancer and in their 40s, and so it's a lot more common than it used to be.
And what is it that you guys think is causing this this in younger people?
Well, that's the million-dollar question. There's a lot of observational studies that have pointed to things like high sugar in our diets, as well as high processed meats. Okay, so we're not eating enough fiber, not eating enough vegetables, eating too many processed foods, and then a sedentary lifestyle that can also lead to increases rise of mainly rectal cancer, which is a part of the colon.
So is this Colon Cancer Awareness Month right now that we're in?
Yes, it is.
So obviously a great time to talk about this, including. And I think I already know the answer to this, but are there any symptoms of colon cancer? You mentioned people typically 40 and older would get screenings, but for the younger people, is there anything you can look out for?
So really, that's the problem, is there's not really many symptoms, okay? Until the cancer gets pretty advanced, there's really not any symptoms. Occasionally, you do need to listen to your body, because there are a couple things that you should talk to your doctor about. If you notice a significant and persistent change in bowel habits, okay, or if you notice blood per rectum. Those are things to talk to your doctor about, and it might be an indication to get an earlier colonoscopy instead of waiting until 50, and it might be a chance for us to find something early.
So again, this is Colon Cancer Awareness Month. It's one of the top cancers in the country, one of the most deadly cancers in the country because of those little to no symptoms. People at home might have more questions. How can they find out more about colon cancer and how to prevent it if they can? Yeah,
there are so many websites. The American College of Gastroenterology has guidelines on when to get screening colonoscopies, and there's a lot of other colon cancer screening tests. It's not just colonoscopies. There's also blood tests that you can check your stool for, and these kind of things that if you're not really wanting to get a colonoscopy, there's other tests to do. But we recommend that you get screened, because that's the best way to find a colon cancer early and prevent it from spreading and catch it before it gets too late.
All right. Thanks so much, Doctor. We appreciate you being here. And again, Colon Cancer Awareness Month, pay attention to your body. And if you need to get screening, go ahead and get that done as soon as possible. Well, coming up, if you live in